William Jefferson Clinton, founder and board chair of the Clinton Foundation and 42nd President of the United States, and Andrew Cuomo, Governor of New York.
Thank you. Governor Cuomo, as you know, you're talking to about 800 students from almost 100 countries, from many from the United States going to university here, but many from around the world who, like a lot of our people, have been dislocated. Some of them are at the beginning of their epidemic, some in the middle, some hopefully at the end. I think everyone who's followed this on the media has been profoundly impressed by the leadership that you have exhibited, mostly by just getting on top of it and working through the problems and telling people exactly what the facts were if you understood them. So, since I think it's clear this is the severest test of your leadership or that of any other governor in a very long time, in your life, in your career, what do you think has best prepared you for this?
Well, Mr. President, first, I can't tell you what a welcome sight it is to see you. These have been some long, long days and long nights. I know you can appreciate it. And you have been such an important influence in my life, and you've taught me so much, and you taught this nation so much. It's just real personal pleasure to be with you. What has prepared me for this? I don't think anything can prepare you for this. How do you prepare to deal with 700 deaths every day, right? How are you prepared for the pain of it, the human suffering of it? It's very hard for me still to deal with it. So I don't know that anything could prepare me, or that I was prepared, or that I want to be prepared to deal with this level of pain and suffering. But you put that aside, for people who believe in government, who believe in public service, who got into this in the first place because they believed they could make a difference and believed government was a vehicle to make a difference, it's the ultimate challenge, right? Government will make a difference literally as to whether people live or die. It's that clear and it's that intense. And it's not about government, whether or not government would like to do it, whether there's a government need as determined by the people and the political process. It's clear. It's a government need, and it has to perform, and it has to perform well, and it's about capacity and competence and making a difference in this moment. And on that level, I've been preparing all my life. I believed public service was a vehicle to make a difference. I believed that in my 20s. I was involved with not-for-profits and causes, and I was helping the homeless in my 20s. But my father was governor, and he left me with a legacy of government is actually a vehicle to make large-scale change quickly. You can do a lot of good in a lot of places in life, but government can actually make a large difference quickly when done well. And then I learned the art form of making government work. My father and you were my two big teachers, both governors. And as a governor, I didn't understand it at the time, but as a governor, you must make the process work. You must make the machine operate. You have to get the legislation passed to make a difference. You have to have the agencies function to make a difference. And there's a practicality to being a governor that, frankly, a legislative position or some other positions don't have that same orientation. So you gave me a respect for the occupation of public service as a government official, as a manager, as a leader. You have to be a communicator. You have to be capable of managing a government. This moment in time brings all that together under this intense pressure. But it's everything you taught me. It's everything my father taught me, just at a level that I never thought anyone would ever ask anyone else to perform at.
Well, let me ask you something. One of the things that I've heard you talk about a lot in your daily briefings, and that I am painfully familiar with because of the work my foundation does around the world, as well as in American states with some of our projects, and especially trying to feed poor children and homeless people around our library in Arkansas. But one of the things that it really has bothered you is this competition among the states for vital equipment, which has bothered a lot of smaller states even more because they feel like they're losing a bidding war. And then you were talking about the competition even within New York among the big hospitals. And without a published list of what supplies are available every day, and without some sort of buyers consortium, it's been tough to deal with that. So the reason I'm asking this question partly is these other states in America have a long way to go, and there are countries represented by people on this phone call who are just about to face this. So what's your advice on this? How should we avoid what would normally be healthy competition, which doesn't make a lick of sense when you're short of life-saving material, when you're trying to develop medicines that at least might keep people alive, even if they won't cure people? Why is this the wrong thing to do, just letting the competitive juices run, and what should we be doing?
As I've been working through this, I have to work with a lot of governmental partners. Federal relationship is very important, as you know. Everyone's been working well together. But when they do the retrospective on this, and I've said it during the process of it, the federal government had a different role than they have played here, right? I mean, we did, thanks to you. You had the best emergency management operation I think that the federal government ever had. But I was the HUD secretary. I worked with FEMA. We did all these situations together. We did the Midwest floods, the Los Angeles earthquakes, Hurricane Andrew down in Florida. You had me go to other countries to help on the rebuilding. That federal role is so important. This was a federally declared disaster. This was not a New York State declared disaster or a California disaster. It was a federally declared disaster. Where was the federal government stepping in? Where was FEMA as the main entity managing this for the nation? You're exactly right. We got into the situation where every state had to manage a federal disaster. How does that happen? And we're all trying to buy the same materials. Everybody needs masks, gowns, and ventilators. So it was like being on eBay internationally, competing against every other state and competing against the federal government to buy the equipment. And if you're a smaller state, New York could outbid you, and California could outbid you, and Illinois could outbid you. But it should have never happened that way. We're going to have the same situation on testing. You watch. These private sector companies do testing. No one has the scale or the volume that we need. You can't buy the swabs. You can't buy the vials. You don't have the manufacturing equipment. So you're going to have another situation of 50 states all competing, trying to buy the testing. I've been saying today, the federal government has to take over testing and let them figure out how to bring it to scale. But every level of government should do what it does best in that situation. And when you have a national emergency and it's a nationwide situation, the federal government, to me, is still the key player, right? When we would go in with a regional emergency, the federal government was the main player, and you organized the states under you. And you deployed resources as the federal leader. That's what should be happening here.
Well, do you believe that I noticed, I saw you put up a tweet once saying maybe the states themselves could set up some sort of buying consortium and have a purchasing and price bargaining agent for all the states. Do you still think that's possible?
In this, conceptually, yes. In this time frame, I don't think so. Because look, it would have to be a consortium that literally spends billions of dollars and gets organized and delivers the product in 10 days, right? I need testing now of a scale never imagined. And I need that testing capacity tomorrow. New York, for example, since this started, we performed 500,000 tests, okay? Let's call it a month. 500,000 tests in a month. That's more than any state in the United States has done. That's more than the next 3 states combined have done. 500,000 tests sounds like a lot of tests until you remember this is a state with 19 million people. And that was 1 month to do 500,000 tests. And that was before the competition of all the other states kicks in. And now all those other states are going to be buying the same capacity that I have been buying. So to get that up and organized quickly, I don't think you can set up another entity. I think the federal government could come in, do the purchasing, do the acquisition, figure out these supply chain issues. I'm working with these private sector testing companies that need to get supplies from China. What do I know to help them to get supplies from China? You know, it's not what I do. It's what the federal government does. And that's the role they should be playing.
First of all, let's play this test thing out a little more. I saw that you and the governors of several other nearby states have announced a joint plan for how you will go about determining how to start the economy up again without risking people's health. Do you think that this group of states can purchase anything together and maybe speed up the supplies necessary for you to isolate people who are positive and need to be given care and taken out of the economy?
Well, it's interesting. I have a consortium, if you will, of my region, my neighboring states. So about 7 states, Massachusetts, New Jersey, Connecticut, Delaware, Rhode Island. And we're all working together. Connecticut, we're working together. And we're doing, in essence, what the federal government could have been doing on a smaller scale. First, the curve of this disease hits different places at different times. So I've been saying, let's follow the path of the curve from place to place. In other words, New York had the first curve. New Jersey is going to have the worst of it in about 8-9 days, they say. Connecticut is after that. So why don't I send my medical equipment, because I'm now on the way down, I take my material and personnel and I help New Jersey. And then we both go help Connecticut. We're doing that. That could have been better organized, frankly. And that's going to happen right across the country. Florida has a different timetable. Texas has a different timetable. Once you staffed up and had the equipment to handle one high curve, and New York was the high curve in the first curve, if you can handle the New York curve, you can almost handle any other curve, right? Our numbers are so much higher than any other place. Help me, and then I'll send all my medical equipment and personnel, and we'll help you a week later, and a week later, and a week later. We're doing that within our consortium. Could have been done on a federal level. In terms of the testing, it's the same thing. We're going to be trying with our cooperative effort to pool our laboratories, pool our health capacity. We need tracing agents in the hundreds and hundreds of people, right? You take the test and then you trace back all the contacts. It's never been done on this scale before. This is an army of tracers. They're basically investigators. We will do that the best we can with this 7-state consortium. But it could have been done from the federal government on a much tighter, more efficient basis.
Well, it may not be too late on this one. I agree with you on this. This contact tracing is very important, and it could enable our entire country for the first time to have a real public health system, a real public health core. And I've thought about it in a lot of different ways. Could we make this a part of AmeriCorps and encourage people to come and do this work and earn some credits to go to college, for example? Is there some other way we could do it? But I know that my friend, whom you know well, Paul Farmer, is heading up a program for Massachusetts now to try to get a state contact tracing core. But you got to get all those bodies in there, and they got to be trained, and they have to be safe while they're tracing. You can't just show up in your jeans and t-shirt. You got to really know what you're doing when you're going into these neighborhoods and you're trying to run these leads down. So do you think maybe you could get the governors to ask the Congress to fund that as a part of all this money they're giving you? Or maybe it's legal now to spend some of the money, but we need a national core of healthy people who are properly trained to go out and do this contact tracing. We need the bodies.
Well, contact tracing for sure. I agree 100%. But I'll tell you, the eye-opener for me is your first point, how little of a public health system we have. You realize how our health system is really a private sector system. We call them voluntary hospitals, but they're not for profits, but they're private sector hospitals. And they run their own businesses. We have downstate New York, right? New York City, Suffolk, Nassau, Westchester, that whole metropolitan area. We have about 100 hospitals. We have about 13 public hospitals. And the rest are all private hospitals. And when I had to go there and basically ask these private hospitals, we have to work as one because now this is a public health mandate. They're not public health hospitals. They're private hospitals, and they have their own clientele and their own patients and their own marketing department and their own market niche. And they don't coordinate with the others. They just don't do it, and the capacity and the equipment they had was what the market would support. They didn't create an extra bed in case of catastrophe. They only had the number of beds that they could sell, right, to the market. So there was no additional capacity beyond what the market would pay for. And I went to the hospitals. You'll get a kick out of this. We have 50,000 hospital beds. They were projecting that I would need about 140,000 hospital beds. And we only had a capacity of 50. I mandated that the hospitals create an additional 50% capacity in every hospital. You had 100-bed hospital, you had to go to 150 beds. So they were putting beds in auditoriums, they were putting beds in cafeterias, they were converting everything because you did not have any public health capacity in the entire healthcare system. It's a concept, public health, but there was no physical manifestation of it. There was no capacity. So that's the main eye-opener. This pandemic, we're not ready from a public health point of view for any large-scale epidemic management. So I think when we get a chance to sit back and learn the lessons from this crisis, the big eye-opener to me is, where is your public health system? You teach it in schools, you talk about it a lot, but it doesn't exist. Not in buildings, not in beds, not in equipment, not in staff. And that's what this really showed us. We called up the public health system and nobody came.
Well, I think one of the things that we owe it to the country to do is to try to create one for the next time. and I don't want to get ahead of myself. We got to get a hold of this one first. But I remember hearing about and then seeing as a young governor 40 years ago that we had a very active public health system in my native state, Arkansas, and a lot of southern states because they had no hospitals during the Depression to speak of. And so a lot of work was being done in the county health units. Then when we were trying to get 90% of our kids immunized against serious childhood diseases, almost everybody in my state, including upper income people, were doing it at the county health unit. And there's some basic public health functions we need to identify and develop the capacity for. That's why this stockpile is so important. And I hope, it'll be adequately stocked from now on in. I know you had some real heartburn moments thinking you couldn't get enough ventilators to do what you needed to do. So let me ask you one question in closing. I don't suppose any of us could be surprised by the fact that there was racial disparity in the number of people who were positive for the virus and the death rates. But I think the size of the disparity in some places really shocked people. We know that African Americans and Latinos are, other things being equal, more likely to have diabetes, type 2 diabetes, and heart problems and other things. And that makes you more likely to die if you get infected with coronavirus. But what's your take on this, and what should we be doing about it?
Yeah, I think it is I don't know if it's an eye opener, but I think it's an issue that now no one can deny, right? It just surfaced a reality that is painful, which we knew was there, but many people wanted to just deny. And I think we're doing more testing in minority areas. We're doing research at those testing sites that goes beyond just the medical tests. Where do you work? Where do you live? What's your health history? What were your health services? Where were you getting health checkups, underlying illnesses, et cetera? So we're trying to accumulate all the data. But there's going to be a clear correlation with disparities in healthcare. There's no doubt about that. And I agree with what you said, Mr. President. There's going to be underlying illnesses and just a general lack of wellness in that community. Our numbers, by the way, are not going to be nearly as bad as many other states in the United States, and that little bit of comfort in that. We do have a disparity on the Latino and African American community, but it's in the single digits as opposed to some of these gross disparities we see in other parts of the country. But there's also
Why do you think that is?
Well, I believe our healthcare system is more equitable here than in other places, and we are very aggressive in reaching out. We're up to 97% of the people in this state have healthcare coverage. 97%. It's one of the highest percentages in the United States. So our people are covered, and we have been very aggressive about the coverage and the outreach. I think one of the other factors, which is just my guess, I haven't seen any backup for this. When we went to essential workforce, what was the essential workforce that continued to operate after we closed down? Transit workers, healthcare workers, bus drivers, grocery store workers, pharmacy store workers, truck drivers. That's going to be a largely majority minority workforce. That's going to be African Americans, Latinos. They were out there doing the jobs while everybody else was locked up. They were the public employees who kept society functioning. And they were exposing themselves on a continued basis to the virus while everybody else had the luxury, frankly, of staying at home, right? Not that staying at home was a luxury for anyone, because cabin fever is very real, as we can all attest, but they were the essential workers. And they stayed out there, and they did their job. They were the nurses. They were the orderlies in the hospitals. They were cleaning the hospitals. They kept those subways running. They kept those buses running. They drove the truck to bring the groceries. And they got infected at a higher rate because of it. I believe that's going to be one of the factors.
Let me ask you this. What would you say to these young people who are watching this, who are concerned about this, wondering if it's going to compromise their entire future? Some of them may wonder if they'll even be able to finish university, or if they do, whether there'll be anything out there for them to do except be a contact tracer. I mean, what do you say to them? How should they think about this, and what should they personally do?
Well, I live with that question every night. You were there when my three were born. I have them home now. One was supposed to graduate this year from college, and it ended early. So she's with me, and she's bemoaning the fact that she's not going to have a graduation on top of everything else that went on. My other two graduated a couple of years ago, and they're still trying to figure it out. But look, there's a tragedy to this. And I'll tell you the truth, I'm sad on a level that after my entire life's work, in many ways we're handing them a planet with more troubles and more issues than the planet that was handed to us. They have bigger problems than we ever had. The environmental problems they have, the economic inequality that they have, the increasing public health issues, the environment's degradation. I mean, they really have more challenges than we did. I think it has shown my kids, that generation, a different aspect of government and politics. It's not just about celebrity and personal style and social media. There is an art form to government. You have to know how to do this. It's sort of like any other occupation now. A lawyer needs to know how to practice to be a good lawyer. A doctor needs to know how to operate. A government official has to know the tools of government. They have to know the management of government. They have to know how to pass a piece of legislation. It's not all theory and abstract. Day to day, I'm not doing any theory and abstract. The concept is simple: save lives. Okay, how do you manage the hospital system? How do you coordinate with the federal government? How do you balance a budget in the midst of this? You either know that or you don't. And I think it gives a practicality to the competence of the people we pick, which frankly has not been in the political dialogue for many years. It's been all about ideas that sound good rather than ideas that are good and sound, as my father used to say. So, yeah, we're handing them a difficult plate with many issues. But they've also seen that government can make a difference and people can make a difference if they get involved and if they know what they're actually talking about and have the skill and ability to do the job in government.
And if they work together and care more about doing the job than who gets the credit.
That's right. That's right.
I think one of the reasons that you have elicited such a strong response from our public here in New York, and obviously for reasons you've already said, my family and I are very biased in your favor, but I think your response has come from the fact that you played this on the level. You played it as a governor, as a father, as a citizen. You emphasized how to do things, not just what to do. And you took responsibility instead of slinging blame. And I admire you and for doing it. I'm proud of you. And I think that the young people watching us from around the world should remember this. If you're ever in a place of responsibility, first of all, know what you're supposed to know. Secondly, get the people around you who can figure out how to do what you talk about. And thirdly, take the responsibility and don't talk about blaming. Get the job done. There are lives on the line here. We're going to be okay, but it's going to take a while. And I'm glad you're there. Thank you.
Thank you. Thank you very much, Mr. President. It's my honor to be with you. I miss you.
Thank you.
I'm Katrina Villas-Cisneros, and the future is fighting for human rights.
The future is fighting the opioid epidemic.
The future is fighting climate change.
And protecting natural resources.
Tackling domestic violence.
Is empowering refugee women.
Zero discrimination and equal job opportunities for everyone.
Equitable access to education.
Tackling substance abuse.
The disaster resilient world.
The future is empowering the next generation of leaders.